Today, I'm going to be talking to you guys about occupational therapy and how can it improve cardiac health. So, to understand how occupational therapy can help coronary heart disease, we need to understand its effects. Starting with what coronary heart disease is, it is a narrowing of the coronary arteries. It causes weakness or fatigue, tightness in the chest. You become easily winded and lightheaded. It also gives an increased chance of stroke and an increased chance of heart attack due to the narrow arteries. So, occupational therapy can help limit the setbacks that are caused by coronary heart disease by allowing us to be more aware of our stress. When we're aware of our stress, we prevent it from building up and instead can control it and relax, which brings us to our relaxation techniques. Most of these are just breathing techniques that allow us to slow our heart rate, lower our blood pressure, calm down, and be conscious in the moment of our stress. Picking up hobbies and things that we enjoying day-to-day life or things that we do more often. And energy conservation. The more energy we're spending, that especially someone who has had a heart attack, they're not going to have as much, and they're going to be more tired and fatigued much easier. So, working on energy conservation and pacing yourself throughout the day is also something that can be used in occupational therapy. So in order to limit the setbacks using occupational therapy, we need to have a SOAP plan. SOAP stands for Subjective Objective Assessment Plan. The subjective portion of SOAP plan is basically what we know from what the patient has told us. The objective portion of SOAP plan is what we know from the vitals, so like height, weight, blood pressure, anything that can be measured. The assessment is assessing what is wrong or what goals we have in mind along with what the patient has in mind and determining what we need to focus on in order to move forward. Plan is the detailed plan of everything and how we're going to work towards what we talked about in the assessment. So the subjective portion that we're going to go over, we find that we have a 54-year-old male who has low motivation and fatigue. It's probably due to the heart attack that he told us he had in the past. We see that the objective portion of the SOAP plan tells us that he is 5'10", 210 pounds, so just slightly overweight. He's taking beta blockers in order to keep his heart rate down, and he has high blood pressure. So this is obviously something we're going to have to take into consideration when we form the assessment and the plan and work towards better health and better lifestyle and preventing high blood pressure and maybe even losing weight. The assessment part of the SOAP plan, we're going to start with diet. Diet is key to any type of physical healthy lifestyle, especially where he's slightly overweight. Reducing stress and anxiety and heart rate. We can use relaxation techniques and breathing techniques, and we can also give him home adaptations. So if he's slightly fatigued or has trouble going up the stairs, we can give him accommodations that will prevent him from injuring himself or make living at home easier. For our final part of the SOAP plan, we're going to have plan. So during sessions, they will come in for sessions in outpatient therapy. He will do light cardio and relaxation techniques. This can involve a number of things. And we're going to give him some at-home responsibilities, which is the diet and accommodations. So following through with our plan, we can have the patient come in 3 times a week and meet with a therapist performing yoga exercises. Yoga exercises are great for cardio. Also, during yoga, focusing on breathing techniques and relaxation in order to lower blood pressure, decrease anxiety and stress in general that may cause stress on the heart. Relaxation techniques can not only be done during yoga, but we can also give them to the patient to do at home. Most of them include breathing techniques. So some of the breathing techniques we can give them are bumblebee breathing. During bumblebee breathing, you would be sitting comfortably. You'd place the tips of your fingers in your ears and close your eyes. You then breathe through your nose slowly and hum as you slowly breathe out. We could also do tummy breathing. where you lie on the floor and place a small stuffed animal or pillow on your stomach. This can also be done with children. You breathe in slowly through your nose and feel the pillow rise, and watch as the pillow rises with your stomach, and then watch it fall slowly as you exhale through your mouth. You kind of want to focus on just rocking, if it's a stuffed animal, rocking it to sleep. The next one we can do is shoulder roll breathing. In this one, you want to choose a comfortable sitting position and take a slow, deep breath in through your nose. Raise your shoulders up towards your ears. Breathe slowly out through your mouth, lowering your shoulders as you exhale. Repeat slowly, rolling your shoulders up and down in time with your breath. So these are very good breathing techniques and relaxation techniques. Yoga is also very good in helping with stress, muscular endurance, just physical fitness in general, like cardio. I really appreciate you guys watching this video. Thank you. I hope you learned a lot.